And the reason we know about this reported conclusion of the Centers for Disease Control, about what Americans should be doing, about what advice Americans should get in the middle of this crisis, is because somebody who is not authorized to speak publicly about the matter was apparently freaked out enough by this advice being spiked by the White House that this person instead went to the press, went to the Associated Press, to make sure that the word got out, because otherwise, how will people know? If the best expert advice from the Centers for Disease Control is that older Americans should not fly, and the White House has spiked that advice for whatever reason, and so individual officials have to leak it in order to let the American people know that's the real advice. This is an important moment in this crisis, right? This is the worst case scenario that you get from a government that doesn't know what they're doing and is willing to lie to the people about things that will keep them alive. And so this kind of leak, anonymous tip to the press, is how we, the American public, are going to get access to the real recommendations of the real experts who are supposed to be giving us advice to save lives. Right? But anonymous officials leaking it out because the White House has stopped the advice from being given. There have been a lot of problems with the federal government's bungling, I'll say it again, because I'm trying to be nice, and slow and internally contradictory and craven and dishonest and ignorant handling of this crisis. But honestly, if the White House is blocking the CDC from telling Americans very basic stuff like this, very simple, direct rules and advice, if you're old, don't get on a plane, I mean, if this is really what's happening, that is A, really bad, and B, I would expect more people at CDC to be squawking about it beyond one unnamed official, quote, with direct knowledge of the plan, who felt the need to anonymously leak this out to the press so that the people would know what the real advice is. Meanwhile, the actual advice that is being dispensed from the federal government right now is comparatively woolly and mealy-mouthed and not really all that directive. I mean, the Secretary of Health and Human Services, Alex Azar, said people with health problems and older Americans should avoid crowds, quote, especially in poorly ventilated spaces. Crowds in poorly ventilated spaces. You mean like airplanes? Is that what you're trying to say? That older people and people with underlying health conditions maybe shouldn't get on an airplane? Is that what you mean? But we have to piece it together? Has somebody told you can't say old people shouldn't get on airplanes right now? Are you hinting at that? Blink twice if you are.